Hello, my name is Justin Harrison. This video discusses lumbar radiculopathy and was created for the PTA 420 Outpatient Care Practice course at Pima Medical Institute. Here's a look at what will be covered throughout the presentation. First, we'll go over some background information on the condition. Next, we'll discuss strategies to manage lumbar radiculopathy. After that, we'll have a look at what the research literature says on the condition and its treatments. Finally, we'll sum it all up. The intent of this video is to answer a focused clinical question. Would including manual therapy techniques as part of a physical therapy plan of care be beneficial to managing lumbar radiculopathy? In the following few slides, we'll talk about what the condition is, including signs and symptoms, causative factors, and current treatment strategies. This condition is one of the most common complaints evaluated by spinal surgeons. Radiating pain down the legs is the hallmark symptom and is often accompanied by low back pain. The passive straight leg raise pictured and described is a typical way to test for irritation of the sciatic nerve or a lumbar nerve root. Symptoms would be experienced in myotomal and dermatomal patterns. It is important to note that further MRI and electrodiagnostic testing should follow to confirm the findings. Lumbar radiculopathy is a secondary condition. Compressive nerve root irritation due to a number of degenerative spinal conditions are the main cause for this. Age is a factor, as well as having a physically demanding job. Infections and certain types of cancers can also aggravate nerves. Conservative management is recommended in any case, whether leading up to surgery or not. Epidural steroid injections can help decide if arthritic changes in the facet joints or nerve root compression is the pain generator. Outcomes following surgery seem to be better overall for those with severe symptoms. Most patients improve with time, regardless of whether they have surgery. Next, we'll talk about some methods to manage this condition conservatively that include therapeutic exercise and manual therapy. I'll also focus on specific and proven effective examples of each. Therapeutic exercise is standard in most physical therapy plans and can help to improve one's biomechanics during daily tasks. Correcting postural abnormalities or dysfunction can go a long way in reducing back pain and radicular symptoms. Strengthening certain muscle groups like the glutes and the core are essential for long-term spinal stability. Dynamic neuromuscular stabilization, or DNS, is a method that was designed by a physical therapist to coordinate spinal stabilizing muscles. The approach involves regulating intra-abdominal pressure with the CNS and trains muscles to work correctly with both stabilization and movement functions. DNS uses developmental kinesiology, or the way that infants mature physically, as a framework for exercises. Figure 3 shows regulation of intra-abdominal pressure by coordinating the muscles of the pelvic floor, diaphragm, and transversus abdominis. Figure 4 illustrates the increased shear stresses that can be placed on lumbar spinal segments with poor spinal stability. Figure 5 is a good representation of how developmental kinesiology and various related positions are used to train the central nervous system with DNS techniques. Manual therapy is not a primary intervention. It is especially helpful to manage pain symptoms during the acute phase of lumbar radiculopathy. Manual therapy can include joint manipulations or mobilizations, traction, massage, or neurodynamic techniques. Progressive inhibition of neuromuscular structures, or PINs, and spinal mobilization with leg movement, or SMWLM, are both proven effective manual therapy techniques for managing lumbar radiculopathy. A 2021 study found that using the two in combination was more effective than either technique alone. PINS uses ischemic pressure with index fingers along the nerve path at two endpoints. After a 30-second hold at the most and least sensitive points, the clinician moves 2 centimeters away from the most sensitive point towards the least sensitive point along the nerve. They continue this pattern of 30-second holds until the two endpoints are 2 centimeters apart. Spinal mobilization with leg movement is where a therapist creates space in the intervertebral foramen where the nerve root exits, while the patient performs an active assisted straight leg raise in a side-lying position. Figure 6 shows the PINS ischemic pressure technique, and maybe a little more. Figure 7 shows the spinal mobilization with leg movement technique. Notice one clinician mobilizing on the spinous process with stacked thumbs, while an assistant supports the weight of the leg. It is important as healthcare providers to back our treatments with scientific research. Next is a short review of the literature surrounding lumbar radiculopathy and treatment methods. The current guidelines are to treat this condition conservatively, including physical therapy, for 4 to 8 weeks before considering surgical intervention. Surgery has been shown to be the most beneficial in the long term and to those with severe symptoms. Therapeutic exercise has been shown time and again to be effective in managing symptoms of lumbar radiculopathy. DNS is a good example of an evidence-based approach to address the causes of lumbar radiculopathy, spinal instability that leads to nerve root irritation. Muscle weakness, physical trauma, and discopathy are commonly treated by therapeutic exercise and have been researched exhaustively. PINS and spinal mobilization with leg movement are proven manual therapy techniques to address lumbar radiculopathy. Traction has also been shown to be especially effective in cervical presentations of radiculopathy, and some positive effects may be inferred to carry over to lumbar cases. That said, there is a relative lack of evidence overall to support manual therapy in the treatment of lumbar presentations. Let's wrap it up. We talked about what the condition is, nerve root irritation secondary to something else, how it was managed, conservatively and/or with surgery. We also covered what the current scientific literature says, especially about integrating manual therapy into a treatment plan. So, what is the answer to the clinical question? Yes, manual therapy has been shown to improve the functional abilities of those with lumbar radiculopathy by reducing acute pain symptoms. It may be worth a change in practice. Thank you for watching.